If you used to be the woman who handled everything and now answering a text, making dinner, or walking into a noisy store feels impossible, stay with me for the next 10 minutes. You may have lost access to the machinery that you were using to keep your whole life running. I'm Dr. Sarah, and I understand this from both sides of the exam room. As a physician and a late diagnosed neurodivergent woman, what I see over and over is women who have spent decades overfunctioning, masking, compensating, and getting praise for how much we can carry until one day we can't carry it anymore. The question we ask ourselves is, am I burned out? Right? And what is the answer we give ourselves? Something is wrong with me. So stay with me for the next 10 minutes, okay? What burnout actually looks like and what it is in real life, okay? Autistic burnout has been described in the research as a state of severe, prolonged exhaustion, right? This is where chronic fatigue syndrome comes in, loss of function or skills, and reduced tolerance for sensory input, things that we are already dealing with. ADHD burnout is not really clearly defined in the literature, but what we see, and I see over and over again, is a similar collapse after we've had to sustain our executive functioning demand, that emotional regulation, overcommitment, compensation, time and time and time again. Okay. You know this. This is a developing field, right? We need a lot more research, but this pattern is consistent through lots and lots of people and lots of patients, and I think it deserves to be recognized. This isn't something that's I just had a bad week, right? Or I'm having a bad couple of weeks, right? This looks like I can't start tasks I used to be able to manage, okay? Noise, touch, light, conversation can become unbearable. You can be losing words, struggle, canceling plans because your preparation and your downtime afterwards are too much. Um, Normal, you may need recovery from events, but it's far more than that. And a lot of burnout shows that we still care deeply, but we literally cannot access the capacity to do anything about it, right? To get ourselves up, to go, to do. That's what burnout can look like. Okay. Um, we may still want to parent and work and exercise and socialize and create. The desire is there, but we're missing the capacity. Okay. Nothing is wrong with us. Our system is talking, ladies. Our system is telling us we need to halt where we are and do something different. Okay. Also, I see this a lot. Burnout can overlap with depression. And a lot of times, actually, burnout gets misdiagnosed as depression. Anxiety, sleep disorders, thyroid disease, anemia, right? One distinction that we describe as this: in depression, pleasure and interest may actually disappear as well. Where in burnout, I see a lot of women still have that desire to do things. It's almost like we just don't have that cellular capacity to do them. You can't mobilize enough energy. You can't get enough executive functioning to get you over that hump. Okay. Um, but depression we have to make sure that there is not overlying depression in this. And then furthermore, like, why does this happen to us, so that we can put things and institute ways to help it not, right? Burnout is rarely caused by one dramatic event. Now sometimes that dramatic event is what tips us over, right? But it's really a cumulative cost of living beyond our capacity for a significant period of time. For years, right, we have used urgency to create dopamine, right? Perfectionism to prevent criticism, people pleasing to avoid rejection, over preparing, right, to compensate for that working memory challenge, adrenaline to force task initiation. And the one thing we're really good at is masking, right? To look calm. Well, we're really in this sympathetic spiral of doom, okay? These strategies work until they don't. Okay. And because they helped us succeed, nobody ever questioned the cost of those for us. They may not even have actually known we were doing it. They may look and say, wow, you're amazing. You're successful. We've become the capable one, the dependable employee, the mother who remembers everything, the physician, executive, teacher, military officer, or business owner who keeps functioning no matter what. I don't know. I can't tell you how many times I've heard in my life, I don't know how you do all the things you do. And then I look and I'm like, yeah, neither do I. Right. Then what happens? Midlife arrives, hormones are starting to change, plus the workload can increase, right? We can have aging parents, we have children. Most of the times we're in a really good spot in a career, right? a household, a body that needs more recovery, not less. Can become less reliable as estrogen is going down and progesterone and testosterone, okay? The coping skills that actually were keeping us upright at 32 may not be working the same at 47. Okay. And I want you to hear me this. This doesn't mean that estrogen explains every single symptom, right? It means that the brain, the body, hormonal environment, sleep, and accumulated life load can collide at the same time. And that is what's happening. And it exposes our neurodivergence and exposes the cost we've paid that we've had to compensate for it. Most high performing women respond to lost capacity by increasing the pressure on ourselves. What do? We get a new planner. We wake up earlier. We add a new supplement. We shame ourselves. Come on, Sarah, you should be able to do this, right? We promise to be more disciplined, to exercise harder, to work later to catch up. But the way out of depletion cannot be more of the behavior that depleted us in the first place. If the nervous system is overloaded, more demand is not the treatment. Okay, we've got to get out of that sympathetic spiral of doom. Okay, great, Dr. Sarah. So where do we start, right? First rule is rule out any medical contributors, right? If your function has changed significantly, sleep, we got to look at sleep. We got to look at medications. I want to look at your thyroid function. What's your ferritin? What's your nutrient deficiencies? Okay, when clinically appropriate, mood, pain, infection, metabolic health, and hormonal health, right? Don't accept the answer of your labs are normal. It's just stress. Okay, we got to look there if there's anything we can do. Number two, stop adding additional demand. For the next week, identify what is truly required from you. Burnout recovery often begins actually with subtraction. Okay, subtraction. Number three is lower the sensory load. Dim the lights, use headphones, simplify meals, reduce unnecessary driving, crowds, transitions, right? Sensory protection isn't weakness, it's resource management. Okay. And it's hard, it can be harder than it sounds. Four is protect the biological basics. So we need to sleep better. We need to take our medication. We need to move, right? We don't need a perfect wellness routine. We just need to be able to fuel that body, okay? And then tell one person safe the truth, not the polished version, not the real version. I'm not functioning the way I normally do, and I need help reducing the load. You don't have to announce your burnout to the world. Okay, but secrecy keeps you performing the exact role that helped you create it. It's just like if someone twisted their ankle, right? And you're on crutches, that's a visible injury. So people are like, oh, let me help you. Let me hold the door open. Recovery from this is not a straight line, and it's not a straight line back to that old version. And that's actually probably good news, right? Because the old version may have been productive, impressive, and but deeply unsustainable for most of us. Okay. Recovery can mean rebuilding a life that uses fewer emergency systems, right? More external support, clearer boundaries, less masking where it's safe, and realistic pace. Work that matches your brain, more recovery after high demand days. The goal is not to become capable of abandoning yourself again. The goal is to become functional without requiring constant self betrayal and recognizing that the way we were doing it potentially isn't the right way. This is our body asking for help. That is exactly what burnout is, right? If our low point feels frightening or you're worried you may harm yourself, obviously you need to reach out, okay, to a qualified professional, a local crisis line. We all can get there, okay? So please, if that's happening, please listen. For everyone else listening quietly and wondering whether this is you, start by reducing one demand and telling one person the truth. The first step out of burnout is not proving that you can still do everything or that you should. Okay, it's finally admitting that you should not have to do it all and you never should have had to. Okay, I'm here with you. I've done it. Please, please, please pass the word along and see what you can do this week. Till next time, stay well.